A $350,000 grant to an Athens group will be used to improve maternal and child health in Southeastern Ohio. Integrating Professionals for Appalachian Children, or I-PAC, is focusing on the problem of low-weight births. I-PAC President Jane Hamill-Lambert joins us now in our studio. Thank you so much for being here this evening.
Thank you for inviting us.
Now, I-PAC was recently awarded a $350,000 grant. That's a lot of money. How will you use it?
Yeah, we were delighted to be selected. Governor Kasich and his Office of Health Transformation identified I-PAC in Southeast Ohio to be the recipient of funds to improve birth outcomes for pregnant women in our region. So we will use the money to build a regional coordinating program for women at high risk and hope we will improve our birth outcomes for our young moms.
Now you're in the planning stages of this, correct? It's not implemented yet.
We're not delivering services yet. No, we're planning on how best to coordinate the resources. The project involves our group, Partners for Kids, which is an accountable care organization at Nationwide Children's, and an existing program, the CHAP program in Richland County, which is Mansfield, Ohio. They've already done some of this work, so they're going to teach us how to do it here. And all together, we expect to have great success.
So it sounds like you'll have good role models to look to as you go through this process.
Yeah, it's a nice example of a program that's been very successful in one community being translated down to another.
Now, when exactly are you looking to have this implemented, this program?
The money will hopefully be in place and employing community health workers to do outreach with pregnant moms by early summer, possibly sooner. So, and then we have a full year to design and implement services.
How exactly, you touched on it a little bit, but how exactly will you go about delivering these services to mothers?
One thing I-PAC's historically been concerned about is that as an organization, we really support collaboration among agencies and service deliverers in the region. So we're going to use the funds to subcontract with existing agencies and their staff to deliver what are called care coordination services to expectant moms. And then those agencies will report data centrally back to I-PAC, and then we'll be able to evaluate the program.
Why are these services so important, especially to expectant mothers in our area and then in general too?
I would say that the healthcare system in general is starting to really consider the importance of delivering supportive services to really many populations, not just pregnant women, but there's evidence that says if we pay attention to all the needs women have, not just their physical health needs, their behavioral health needs, their social services needs, that outcomes are better for the pregnant women themselves and their babies.
All right. Well, Jane Hamill-Lambert, thank you so much for being here this evening and good luck with your project.
Thank you, Alyssa.